All right, and on that note, let's get into a discussion on fighting against the drug abuse. And joining me in studio now is Mr. Victor Okioma, who's the CEO of NACADA. NACADA is the National Authority for Campaign Against Drug Abuse. There's something that you must have seen online right now by then, that the United Nations Commission voted to remove cannabis from a list that categorizes it as one of the most dangerous drugs, a move that recognizes the plant as having medicinal value. So the UN Commission on Narcotic Drugs approved the recommendation from the World Health Organization on Wednesday to remove cannabis and cannabis resin from its Schedule 4 classification under the 1961 Single Convention of Narcotic Drugs. That designation put cannabis and one of the derivatives in a category alongside heroin and other opioids. Forget the kizungu mingi. The basic question is now cannabis legal? And that's a question we're going to ask Mr. Victor Okioma, who's here with us, the CEO of NACADA. Thank you so much for making time. Did the WHO and the UN legalize cannabis?
Thank you, Mbija, for the opportunity to clarify this issue to Kenyans, because it has been a subject of debate in social media and all the mainstream media. UN did not legalize. And I think that is a message that needs to come out very clearly. The debate to relax control on the use of cannabis has been in the CND, which is the policy body for the UN on issues of drug control. And we should have even voted. Kenya is a member of the CND, and as a member, we have the right to vote. And the 53 members of the UN, of the CND, in Vienna last March 2019. And we delayed the voting to allow member states to go and consult before we can be able to put a vote on this. The issue was not to legalize, but to remove cannabis and cannabis strains from Schedule 4 of the 1961 convention, to bring it back to the 1961 convention, Schedule 1. And the reason was basically informed by the World Health Organization research that they indicated that there are certain compounds within that cannabis that are of therapeutic nature. And therefore, where it was in Schedule 1, it was classified as harmful and with no therapeutic value. So the movement is basically to put it in some schedule where those countries that wish to be able to use it for therapeutic reasons can be able to easily access it. And I need to mention that Kenya did not support that. In fact, there were 8 recommendations from World Health Organization, which were all around relaxing controls placed on cannabis. And only one of the recommendations went through. The rest of the 8 recommendations were rejected, some of which included certain percentages can be allowed, of preparations can be allowed so long as it contains 0.2%. That was also rejected along with many others. Kenya did not support it initially, and you know we lost that vote 27-24 and 1 abstention. Which tells you that very many countries still do not support it. And why we didn't support any change is that the current regime actually allows access to controlled substances for medical and scientific reasons. So even if we had left it the way it was for Kenya, we were saying those who want to access it for medical and scientific purposes, the regime still allows it. So there was no need really to change it. But all the same, we lost. But I want it to be clear to Kenyans that cannabis is still controlled by the UN and the CND, and that you cannot access it until, you can demonstrate that it's for purposes of medical and scientific reasons, so as it is now.
As it is right now, it is still illegal.
It is still illegal. And I want to invite Kenyans to look at the amendment of the Anti-Narcotic and Psychotropic Substances Act, which is already in Parliament. And you'll see how the sentences are going to be enhanced for anybody who is going to be found to be trafficking in narcotics.
So the sentences are even going to be enhanced?
Actually, the sentences which have been proposed,
yeah.
huge. They are hefty.
Okay.
Yeah.
So what is
very punitive.
What is the documented use of marijuana in Kenya today, based on the reports and the research that you've done?
Let me say that Kenya marijuana is illegal.
Yeah.
And the documented benefits, I'm not aware of any.
Yeah.
Of course, there is a debate around, benefits of marijuana. And we have seen people trying to apply for the licenses to start producing marijuana for purposes of medical and scientific reasons. But so far, we have not got any approval of that nature.
Okay.
I want to remind you and Kenyans that even the countries that have had this kind of problems, they started production of marijuana for some pharmaceutical companies out there in the US, in Europe. And they have suffered the damage because of diversion of that which was meant for industries elsewhere. And it has really devastated their own people health-wise. So this is a caution we want to give the Kenyans that marijuana should be handled very carefully.
Okay. Yeah. There's a report I was reading. It was a survey conducted in 2019 to assess the emerging trends in the abuse of drugs and substances presented. And there was overwhelming evidence that the abuse of cannabis now, it comes in the form of edibles, you see, like cookies, candies, and other forms of confectionaries. What is NACADA doing to ensure that they tame this new style of distribution?
Actually, that survey we did as NACADA, and I must say the results from that survey should be out very soon. We are doing the validation of the report, and we'll be sharing with Kenyans. There are so many innovative ways Kenyans have embraced in the use of cannabis, and you find it in juices, you find it in candies, you find it in sweets. And what NACADA is doing, first we have done the survey because we wanted to understand the trend, and the survey is clear. And we are going to be sharing this survey to Kenyans and the enforcement agencies. We coordinate with very many security agencies. Whenever we find this kind of information, we share with them so that we are able to focus now on the new methods of dispensing the cannabis. That is what we are going to do, and we are going to share this with Kenyans. And this is even more of a problem in our institutions. So when the students are returning from home and you check and you find they only have cakes, you need to find out whether those cakes are not laced with cannabis. That is the way they're using cannabis now.
Yeah. But there's also been an upsurge of teenagers being caught engaging in drug use. What is NACADA's position on this, and how are you planning to deal with it going forward?
NACADA's position is that we have challenges around parenting. And you see, what we want to encourage is that as parents, we need to monitor the growth of our young people. And when you see signs of a behavior that you have not been used to, because this is your child and you brought him up or brought her up, when you see certain tells or signs, you need to ask what's happening. But because of our nature of parenting, sometimes we are not so closely associated with some of them. Even when they are home, they have their own issues. So what we are appealing is that we need parents to understand that they have a very powerful influence over their children, and therefore need to be closely monitoring them and, kind of put certain rules that control the way we don't want you to be addicted. But we want you to be somebody who is known to the children to say no when they need to say no and yes. But we have kind of like let them on their own. And this is what we associate this problem with. And we are actually currently carrying out a program called Positive Parenting. And we have been in the media discussing issues of positive parenting. And we think that there's a lot more that needs to be done by the parents before we can hand over this responsibility to the teachers in schools. So there must be that kind of, and we also are kind of engaging with the institutions, schools, and we have some life skills for young children who need to understand something about drugs, and as they grow, they are able to say, no, this is cannabis, or this is heroin. Because, we try to teach them to understand that at that early age, these are dangerous substances and you might find them, so run away from them. So that they are able, life skill is to encourage them to be able to know and say no. And we also do a lot of awareness campaigns within our institution. We have a school-based program that we run. And we engage with the teachers. We train some of them to be able to be our contact people in the institutions. And that seems to be bearing fruits.
This sensitization, how much of an impact has it had? Because are you changing the messaging towards the young people and the youth when it comes to drug and substance abuse?
Yes, I think that is really the way we are now looking at these issues. Because in drug control, we do not have one, a single message for everybody. So we have tailored our campaigns in such a way that we identify the population, the vulnerable population. If we are talking about the schools, then we want to find out who is best appreciated by the young people who can speak to them. And we use, in fact, a lot of other methodologies to be able to engage with the various cluster of population that we have to engage. So the message is that we have to identify who is vulnerable. If there are students in schools, how best can we reach them? Who is the best person to engage with them? Because sometimes you go there as the CEO NACADA and they say this is a system. We don't understand these people. But perhaps if we ask them to talk to them, they will appreciate much more. And we do those kind of intervention, identify people who have influence among them, to speak to them, and we have seen a lot of good results by that kind of engagement.
Okay. Let me bring you back to the issue of rescheduling there. And having that being done, how does the rescheduling of marijuana affect its accessibility as we speak?
The rescheduling basically means that it is controlled. And if it's controlled, then accessibility is restricted. That is the simple way of controlling it. Because if it was not scheduled, then what you find is every supermarket, you can concoct something, lacing it with cannabis, and you just sell it. But if it's controlled, countries have their own, what you call lead agencies that implement those kind of controls. In Kenya, we have Pharmacy and Poisons Board. Once this is scheduled as a signatory to the conventions, we are obligated to put those controls. So even locally then, through Pharmacy and Poisons Board, you cannot be found with those kind of substances because they are controlled and we are signatories to the United Nations Commission on Narcotic Drugs. I also saw another report by NACADA in 2017 that showed that at least 1% of the country's population aged between 15 to 65 years are current users of cannabis. This was in 2017. Is this still the situation now, or has that changed? Well, the situation, I think that is the latest. We have done, we do regular surveys. Every 5 years we do survey to monitor the trend. We are likely to do one next year or 2022. From the surveys, that narcotic drugs, and particularly cannabis, is the most problematic for us in this part of the world. And the abuse actually has been on the increase, according to us. But you see, that will tell you when we now do the survey. But the general feeling is that there's been, because when we do school programs, we realize that even the management is saying there's a problem in our institutions, And they can give you cases of several shishas of cannabis in their boxes when they are inspecting.
Yeah.
So it's a problem. And you know, we have done a survey on drug preferences, drug abuse preference in secondary and primary schools. And those things come out. And therefore, what I'm saying is we have a problem. Cannabis is the most abused narcotic in Kenya.
Yeah.
And we have seen a very growing market coming from Ethiopia. The cannabis from Sheshman in Ethiopia is becoming now our biggest problem we have to deal with, coming out through Moyale and going out all the way through Wajir Garissa to the coast region. We have a very vibrant route coming through the Marsabit, Isiolo, finding its way to Nairobi and in central Kenya. We have, of course, I've just come from the coast discussing with the security agencies about the narcotic or the cannabis influx from Tanzania, where I was being told that growing is not a problem in Tanzania. What is a problem is consuming. And therefore, what they are doing is they grow it in Tanzania and just traffic it into Kenya, where there is a good market.
Yeah.
So we have a challenge around abuse of cannabis.
And have you somehow managed to have an interagency coordination to stop that?
Oh, yes, we do a lot of operations together. You know, we have the one government approach in dealing with challenges of security.
Yeah.
And so we regularly organize some of these enforcement operations with the security agencies, with other agencies which have mandate on enforcement, like the public health, you know, Kenya Revenue Authority. Some of these substances find their way in the market through those kind of border points. And we carry out a number of multi-agency operations on this.
Okay.
Yeah.
Tell me a bit more about the Psychotropic Substances and Narcotics Drugs Control Amendment Bill 2020. You had mentioned that it has some very punitive measures. What are some of them? What are your highlights on the
the highlight is, of course, one of the elements of that bill is that it recognizes that we have a serious problem with the narcotics and psychotropic substances. So there has been enhancement of the penalties across the board. We have also introduced things that were not in the 1994 Act, like conspiracies, right? There is now a provision that clearly will identify conspirators, and we also have, you know, these networks, they sometimes communicate. So there is a provision to intercept communication, and you can use it. Yeah. Those are some of the key elements of the new, which were not in the old Act. Yeah. We think that it comes up with certain provisions that will help us to address the current problem. Public officers who are going to be involved have also been captured in this. And therefore, if you found as a public officer to be aiding, the fines are very, very hefty.
Do you generally believe that punitive action will act as a deterrence to this?
We look at it in two ways. Yeah. Punitive for trafficking, and for victims, help them to access treatment and rehabilitation, right? And that is a position as NACADA we have advised, and we are hoping that that will, so that we do not focus on the innocent victims of drug abuse, but we should focus more on the trafficking networks. And that is where we are saying, that is where we need very, very punitive sentences and sanctions. Yeah. But for persons who have been affected and they are in the dens, we are encouraging that they should be assisted to access treatment and rehabilitation.
Yeah. So right now, as we speak, as the CEO for NACADA, what would you say is the biggest win for NACADA? What is your greatest highlights?
Well, the biggest win?
Yes.
We have been able to create the awareness that we have a serious problem in the country. We have engaged a lot because we realize that we have a challenge around treatment and rehabilitation. And we have been engaging with county governments, and through our partnership, we have seen a number of counties start to come up with rehabilitation facilities. The challenge is that 90% of the rehabilitation facilities that currently exist in the country belong to people who are doing business, and therefore they are expensive and inaccessible. Our focus is more public-owned facilities which can be affordable, and of course will respond to the gap that currently exists. I also want to say that as a result of the presidential directive sometime in 2015 to convert the NYS camp in Miritini to a rehab, we have already started the outpatient where 250 people are coming every day to get their methadone dispensation and some psychosocial support. And we are trying to introduce the inpatient either before the end of the month or early in January. What I want to say is that we need a lot of investment around the issues of rehabilitation and reintegration.
Okay, so there's a question here I saw on Twitter. I think it's from Tony. Tony says, can you please ask Mr. Okioma what conclusive research has any Kenyan agency done on cannabis?
What conclusive research?
Yes. Have we done any research on cannabis?
Of course, the research we have done, which I have referred to, is on the preferences, right? That research was carried out by NACADA, and I know that I think the University of, we have shared with the University of Jomo Kenyatta. They have done quite a bit of work around it. And in fact, we worked together when we were responding to these World Health Organization's recommendations. And the research indicates from what we shared with the professor who was in charge of that unit in the university. The research also clearly agrees with the World Health Organization that there are certain therapeutic elements within the cannabis, right? And which supports really the position that we took in a number of the recommendations that we rejected. So I know that there is research that has been done and proved that actually cannabis is very dangerous because it's associated with a lot of mental illnesses, a lot of psychotic issues, a lot of hallucinations. There is a research that shows, and it's documented. And of course, there is also the therapeutic element of it. So it's a question of how do you extract the therapeutic elements for use for medical purposes, and do we have that capacity? Can we go the way other countries that started out in South America and ended up with a serious problem? Can we go that direction? These are issues that Kenyans need to have a discussion on.
All right. But I see you. Thank you so much for making time for us this morning.
Thank you very much for giving us the opportunity to speak to Kenyans.
Asante sana. The CEO for NACADA, Victor Okioma, there, that's the National Authority for Campaign Against Drug Abuse, speaking to us in terms of making it very clear that cannabis is not legal in Kenya. Now you know, all right? So we're taking a quick break here. When we come back, I'll be speaking to Trufena Wakaba, who's a counseling psychologist, and Gregory Mushiri, who's a recovered addict, on this issue as well, just to hear what their perspective is very briefly in the next 15 minutes. Taking a quick break, we'll be back with more.